Good. We'll go ahead and get started then this morning. Thank you for joining us here this morning. We appreciate your time and attention being here. My name is Lori Smith. I am the training coordinator here with Direction Home, Akron, Canton Area Agency on Aging and Disabilities. If you see me looking back and forth, I do have two computers running over. This computer over here is where I'm able to see the chat. So you will see me looking over here a little bit, but trust me, we are focused on you today. I wanted to take a quick moment, if you would indulge me, and run through some Zoom controls. I know most of us now are probably more than familiar with Zoom, but just a few things to keep in mind as we go through this Medicare Made Simple seminar. We will ask that you remain muted during this seminar, and that's just to keep background noises and distractions down to a minimum and allow everyone here to be able to hear the content being given. Because we are muted, I will ask that you open up your chat window, and where that is located, you should see a strip of menu options either on the bottom or top of your screen. And it's about midway across, looks like a little thought bubble. It says chat. When you click that, a chat window will open to the right of your screen, and that's where you can type questions, comments. We will be collecting the questions as we move along. So if you think of something during the middle of the presentation and you want to make sure that it gets answered, go ahead and type that into the chat box as it occurs to you. I'll be collecting those, and we'll be giving those to Francine at the end of the seminar. You will see when you open up your chat box at the bottom, it says to everyone. Please make sure that is the case. That allows everybody here with us today to be able to see that comment or question that you have sent. You are able to send a message directly to one individual here. And if you click where it says everyone, that little down caret, that will allow you to type a message to that one singular person here with us today. And only that person will see it. I won't see it. Our Medicare presenter, Francine, won't see it. So if it is a question and neither one of us are able to see it, we will be able to answer that for you. So please do make sure that everyone is chosen in that chat window. My slides are up right now. If you find the portion of that screen is too small for your preference, you can change that. If you put your cursor in between the slides and whatever is to the right, it might be like a film strip of people who are sharing their webcams, or it might be that chat window. But when you put your cursor in between those panels, it will turn into a double-sided left-right arrow. And when you hold your left mouse button down, then you can drag those panels left to right and adjust the size of those to make it easier for you to view. Everyone should have gotten their supplemental materials either via email, or if you requested hard copies. If you've not gotten them yet, I know I sent out another round of them just yesterday morning. If you haven't gotten them yet and you requested them in the mail, they will be coming shortly, but everyone here with us today should have received those in their email, so you can kind of look those over. And I will happily share with you, you are the first seminar where Medicare Parts A and B numbers have been updated, so you get the full picture. I will also share with you all of this information is also posted to our website, and when things are wrapped up here today, we'll show you where that is if you would like to review any of the information. We are also recording this session as well because the numbers have finally been updated, and we will be posting this to our website as well. If you would like to review this seminar, or you know somebody who wasn't able to make it to one of our seminars and would like to view that. I think that's it for Zoom. I would also, if you would just hang with me for another couple of minutes, I want to share with you a little bit about what Direction Home, Akron Canton Area Agency on Aging and Disabilities is. I know all of you come to these seminars to get this fantastic Medicare information, and that is, we really appreciate you coming to these and supporting us like that. But we wanted you to know that we are so much more than these Medicare seminars, and share with you a little bit about what we are able to offer. So our mission here at Direction Home, you can see here, we provide older adults, people with disabilities, and their caregivers long-term care choices and consumer protections so that they can achieve the highest quality of life. And you can see there what that really means in a nutshell is that we provide choices for people to live independently in the place that they want to call home, whether that is in their home in the community, or if they choose to go to a facility, wherever they would like to call home, we can help them be there. Who we are as a staff, we are almost 250 staff strong. The bulk of our employees are social workers, and they are our care managers and assessors. We also have registered nurses on staff. They also do our assessing for us and some of our care management. We have a state certified long-term care ombudsman department, of which Francine is a part of. We have a dietitian on our staff, and then of course those business professionals who keep us running behind the scenes, our finance department, our IT who keep our computers and our tech running, and our HR department. When you call an area agency on aging, and I'll take a quick moment here to say we are one of 12 in Ohio. Direction Home Akron Canton provides services and supports to Portage, Stark, Wayne, and Summit counties. And if you or your loved one are outside one of those 4 counties and we aren't able to provide services, there is an area agency on aging in Ohio, and in fact, nationwide. They are a nationwide network who can provide those services and support. So if we can't do it and you're looking for someone in your local region, let me know and I can get you that contact information. But whenever you do call an area agency on aging, most likely your first point of contact will be that Aging and Disability Resource Center. And you might see that abbreviated ADRC. And they are really a one-stop shop for all of your questions to get answered and any resources you might like to have. And they can answer questions, and I'll go through some of these quickly, but they can answer so many more questions than what I'm going to share with you here. But they can talk with you about what community and government programs might be available to help you in your local area, how to get help so you or your loved one can continue living in the community if that is your choice, where to get home delivered meals, other things like what senior housing is available in your local area, how to reduce stress from caregiving. We have a fantastic family caregiver program, and where to turn for support with a loved one who has Alzheimer's disease. So again, those are just some of the questions those aging and disability resource representatives can answer for you. This is free and it is available for anybody to call in, and they are excellent at picking up the calls when it rings. If by chance they are all on a line already and you do have to leave a voicemail, they're very good at returning those calls fairly quickly, I'd say within 1 business day. The next stop, if you choose, after you touch base with that ADRC rep, can be a free in-home assessment. These are open to everyone who is interested in long-term care services, and it is completed by a registered nurse. We are just starting to move them back in the home because having an assessment in the home really gives us a much more complete picture than during COVID. We were doing these telephonically. So we can really get a true picture of what services and supports you might need to be able to live in the place that you want to call home. And what that assessment does is it determines eligibility for programs that we at Direction Home offer. And if we find you're not eligible, that nurse that comes out isn't just going to dust off their hands and say, well, lovely talking to you today, good luck. We'll be on our way. They will absolutely put you in touch with community resources and a care plan to get you moving along in the direction that you need to go. I mentioned earlier, we have a fantastic family caregiver support program, and this touches a bit on that. It does provide support to those family caregivers. And what I mean by that are those individuals who family caregiving is not their profession. You're not getting paid to be a caregiver. Maybe you're just helping mom or dad out get to their doctor's appointment or their grocery store, or helping them to make sure they're cooking healthy meals, or chores around the house or in the yard, helping to take care of their finances. You're a family caregiver. And we understand that you're doing that because it's your family and you love them, but we also understand that it can add a lot of stress. So we've got this program that can help all those unpaid family caregivers, and we can help with things like respite education, reimbursement sometimes for services you're incurring. We have a lot of supplemental materials at our fingertips, and we can also make referrals to support groups. We actually have a support group that one of our staff members, Teresa Niewiadomski, runs, and I have heard everything good about that support group. And then we also do offer speaking engagements on caregiver stress and burnout, because again, we understand how stressful, even though you're doing it with the best of intentions and with all the love, we understand that it can cause stress and burnout. So we have speaking engagements revolving around that. Most of the programs offered with Direction Home are Medicaid programs, and I'll touch on these very quickly. Please know that each of these programs that you see listed here, you will receive a care manager to help make sure that you receive each and every service due to you and make sure it is being implemented in the way it should be. The first program you see here, I think, is the one that people are most familiar with, and it is Passport. It is available for folks 60 and older who are Medicaid recipients. We also have the assisted living waiver, and you can see there it's available for people 21 and older. So yes, while Area Agency on Aging is our name, we tacked on the disabilities for good reason. We really can take care of people birth through end of life. Another program that we have is the Ohio Home Care Waiver, and that is for folks 59 and younger. And then finally, My Care Ohio for people 18 and older and who are called dual eligibles. And that means they are eligible for both Medicaid and Medicare. And again, all these programs, they work a little bit differently. They're for a little bit different populations, and they are different things they have different points that you need to qualify for to be able to be enrolled in these programs. But all of them have the overall goal of helping to keep you living in the place that you want to call home. And with any questions you might have about any of these, please do contact that ADRC, that Aging and Disability Resource Center. We have a long-term care ombudsman staff. And what they are, they're where you would turn if you have a home care complaint and you would like an investigation opened in that. They are our consumer and resident advocates. They really go to bat for our consumers and folks living in long-term care or receiving in-home care in their homes. They can also help with long-term care selection assistance. So if you are thinking about long-term care facilities and you would like to know a comparison of the amenities that they offer and costs incurred and how they receive payment, you can call them and they can walk you through that. And again, they are where you would go to help resolve a complaint with nursing home care. And they offer rights-based information in both rules and practices. We have evidence-based education, and that is another part of what I do with the agency. So if you have any questions about these, please let me know. When I turn this over to Francine, I'll put both of our contact information in there, myself and Francine. So with any questions, you've got that available to you. But these evidence-based classes are free workshops that are offered throughout our 4-county service area. And again, that's Portage, Stark, Summit, and Wayne counties. And they help prevent or maintain concerns that you are dealing with. We have 2 classes that revolve around preventing falls, reducing the incidence of falls that someone might be experiencing. The first is Matter of Balance. It is an 8-week program. And it involves a lot of idea sharing, a lot of learning how to be aware of your surroundings, whether that's in the home or in the environment. And then in week 3, we do start some small exercise movements to help physically strengthen those muscles and improve balance. The second of our falls prevention class is Tai Chi Chuan, Moving for Better Balance. It is by far the longest of our workshops that we offer. It is held twice a week over the course of 24 weeks. And if anyone is familiar with Tai Chi, it looks very, very similar. It is based on Yang style Tai Chi, but the 8 forms that we learn throughout those 24 weeks have all been modified specifically for people who have that higher risk of falls. And we start very easy and very slow and gradually increase the complexity of these forms. So again, you can gradually increase your strength, flexibility, and balance skills. We have a chronic disease self-management class that is 6 weeks long, and it looks at any chronic condition that somebody might be dealing with, anything from arthritis to Parkinson's to lung disease, heart disease, anything that is ongoing, that is not going to have a cure, and you just have to manage those symptoms as best you can. We offer strategies to help you do that, how to advocate for yourself in the healthcare system, how to make sure you understand proper nutrition, how to work being physically active into your day-to-day world, so those symptoms maybe don't impede your day-to-day life as much as they could. And then diabetes self-management takes that same idea and drills it down to type 2 diabetes. It's a lot of the same strategies, but again, focused in on type 2. We do touch on type 1, but we take a real hard look at type 2. And we talk about nutrition for type 2, how to, again, work in physical activity, being mindful of when it's safe to do so with type 2 diabetes, things to monitor, and things like that. And then we have powerful tools for caregivers, which again is for those unpaid family caregivers, just helping mom or dad with things. Because I can't say it enough, we understand how stressful that can be. So we work through some tips to help take good care of you. Because if you can't take care of you, then it's really hard to take care of the rest of your family. This is our contact information. Again, if you would like to reach out with any questions you might have, not just the ones that we touched on earlier, they can answer so many questions, anything that you've got on your mind revolving long-term care. That is the number for our Aging and Disability Resource Center. Below that is our website, www.dhad.org. I do encourage you to go there, visit, kind of click around. You can learn a lot about our programs, who we are, other things that we offer. But I will go ahead and stop talking for the moment and turn it over to the star of our show, Francine Chuchanis, that you've come here to listen to and get that fantastic Medicare information. Francine, I pass the torch for you. Thank you for your time and attention.
Thank you, Lori. My name is Francine Chuchanis. I am a long-term care ombudsman. I'm a certified program manager. I have been helping people with Medicare and doing these seminars for many years. I've been an ombudsman for 20 years, and I look forward to talking to you today. So let's go to the next slide. So we'll start out talking about Medicare enrollment. When people first become eligible for Medicare, they have an initial enrollment period that lasts for 7 months. It begins 3 months before your 65th birthday and will end 3 months after your 65th birthday. It's important that people enroll in Medicare in the first 3 months of this initial enrollment period so that coverage, Medicare coverage, can begin the first day of the month you turn 65. If you wait until the last 3 months, so the 3 months after you turn 65, you may have to wait a couple months before your coverage actually takes effect. If someone is receiving a Social Security check, enrollment into Medicare is automatic, and they will likely receive a red, white, and blue card a couple months before they turn 65. However, if you're not receiving a Social Security check, or you're not getting benefits through the railroad retirement system, you must enroll into Medicare, and you can do that in 2 ways. You can go onto the Medicare website at www.medicare.gov, or you can visit or call your local Social Security Administration. If someone happens to miss that initial enrollment period, they can enroll anytime between January and March, but their coverage will not begin till July. And then those individuals who are disabled under the Social Security Administration rules, who are younger than 65, will automatically qualify for Medicare after being disabled for 24 months. There are some special enrollment times when you can change. So if you move out of the county, so if you change counties and you've been in a Medicare Advantage plan, Medicare Advantage plans are based on the county you live in. So if you move or if you move out of state, you do have a special enrollment period where you can change your coverage. Also, if you move in and out of a nursing home, you can change your coverage. If you are working and maintaining your employer insurance and you lose that insurance, you get a special enrollment period. And if for some reason you lose coverage under a Medicare Advantage plan that may be leaves Medicare, you would get a special enrollment time period. And if you are a victim of sales fraud, although you have to prove that, you can get a special enrollment period. There is also a time between January and March of every year. So after open enrollment ends on December 7th of this year, if you select a Medicare Advantage plan and you decide you don't like it, you can change Medicare Advantage plans between January 1st and March 31st, or you can move from Medicare Advantage to traditional Medicare. What you cannot do is you cannot move from traditional Medicare to Medicare Advantage. So we do these seminars now because open enrollment begins every year on October 15th and ends on midnight December 7th. So we like everybody to look at their coverage, consider their coverage, and check it now, because now's the time when you can make changes. And this includes Medicare beneficiaries who also have Medicaid. So you should, if you were on a Medicare Advantage plan this year in 2021, you should have received what's called an annual notice of change, where they sent you a letter telling you how your plan would change. Although I have to warn you, they can decide not to mail those out and put those letters of change on their website. So you might want to look on the website if you were in a Medicare Advantage plan and you did not get a letter. When talking about Medicare, people often say that it's very confusing, and there are some very confusing things about Medicare. But when it comes to coverage, there are only two choices. You can choose to be covered by a Medicare Advantage plan, or you can choose to be covered by traditional Medicare. And there are advantages and disadvantages to both types of coverage. So to join a Medicare Advantage plan, somebody has to have Part B. These plans are not supplemental plans. I get people calling me all the time and say, I have a supplemental plan. Well, what is it? Well, I have SummaCare. SummaCare is not a supplemental plan. It is a Medicare Advantage plan. They're private plans that contract with Medicare to provide coverage. Most of these plans you'll see when we get to them include drug coverage. They have to cover the same services that traditional Medicare covers, but they can include some extra benefits like hearing benefits, dental benefits, telehealth benefits. Also, with these types of plans, there are out-of-pocket limits. So once your out-of-pocket expenditures reach a certain amount, the plan will cover you in full. The downside to these are that there are geographic restrictions and there may be provider restrictions. So many of these plans, you have to use their doctors and their hospitals and their providers. And for some of the services, you would need prior authorizations. So you have to go through the plan and wait for a prior authorization to receive some of the services. Under traditional Medicare, the downside to that is that there are no extra benefits. There are no out-of-pocket limits. There are co-pays, but you can add what's called a Medicare supplemental or Medigap policy. And we'll talk about those a little later too. In addition to that, you would have to add what we call a standalone Part D plan for your prescription coverage. However, under traditional Medicare, there are no geographic restrictions to getting care. You can go to any provider in the United States that takes Medicare, and that's important to some people. Also, there is no gatekeeper, or you don't have to wait for prior authorization to get a service covered by Medicare, like you might under a Medicare Advantage plan. So there is an open provider network. So when choosing, the choice is yours. Medicare Advantage plans, also known as Part C, you will see some have premiums, some don't. As I said, a person has to have Part B. Most of the plans, however, include prescription drug coverage. So you don't have to get a separate plan for prescription drug coverage. It is all wrapped into one. So you have your Medicare A, B, and D in one plan. But you cannot buy any supplemental coverage like you can in original Medicare or traditional Medicare. In Medicare, we all have to pay a premium for Part B. Again, you have to add a separate plan for drug coverage unless you have creditable coverage through another source, which I'll talk about later. You can purchase a supplemental policy to cover your out-of-pocket costs, but there are no extra benefits to date in traditional Medicare. So when I talk about traditional Medicare or original Medicare, I'm going to start out talking about Part A, which is hospital insurance. And late in the day on Friday, the government released these new numbers. They waited till late in the day on Friday to release them because they went up pretty significantly, and we were not expecting that. So it's like when you want to fire somebody, you wait till the end of the day on Friday. Well, that's what the government did. They waited till very late in the day. So for most people, they have no premium for Part A, because if you or your spouse worked full-time for 10 years and paid into the Medicare system, you have already paid into the system and you won't have a premium for Part A. For those that worked less than that amount of time, they will have premiums, and those premiums can be hefty, up to over $400 a month. So next year, when someone has traditional Medicare and they go into the hospital, they will have a deductible of $1,556. And you can see that this is up from what it was this year, which was $1,484. If you're in the hospital, and so once you meet that deductible, you're covered for 60 days. If for some reason you are in the hospital for a period greater than 60 days, you will pay $389 per day up to day 90. If you have catastrophic illness, because this is very rare, and you end up in the hospital for more than 90 days, you can use what's called your lifetime reserve days. And you will have coverage starting day 91 through day 150, but your daily coinsurance will be $778 per day. And again, that's up quite a bit from this year. I want to also mention that in addition to hospital insurance, Part A also covers what we call intermittent skilled home care. And a person has to be homebound to receive these home care services, and they're time limited. That's what we mean by intermittent. In addition to covering the hospital stays, Part A also covers stays in a skilled nursing home. Now, this is not custodial care. Skilled care means receiving physical therapy, occupational therapy, or speech therapy, or if someone is so medically complex that they need monitoring by an RN on a daily basis. Before COVID, a 3-day hospital stay was required for people on traditional Medicare before Medicare would cover their skilled stay in a nursing home. This has been put on hold, so the 3-day hospital stay is not required during the COVID emergency at this time. When the 3-day hospital stay is in effect, people need to be aware that if they are in the hospital under observation status, it does not count to the 3-day hospital stay, because observation status is not a true hospital admission. And it used to be that many people weren't really sure whether they were on observation status, but now hospitals should be informing you within 24 hours whether you are actually admitted or in observation status. So once a person enters a skilled facility for rehab, they are covered in full for 20 days. After day 20, if they still remain skilled, there is a daily coinsurance amount, and next year it will be $194.50 per day. And Medicare only covers skilled care up to 100 days. And it's very, very difficult to stay skilled for 100 days. So you would have to show that you really need that skilled care for that long. A new benefit can begin after, so let's say somebody uses their 100 days, a new benefit can begin after you are not receiving skilled care in a hospital or a nursing home for 60 days. Again, this is waived due to COVID, but it is up to the facility to decide whether to waive this. Part A also covers hospice services. Hospice is comfort care. It is not curative treatment. It includes services for pain relief and symptom management. It also includes prescriptions, drugs, durable medical equipment for pain relief. And your co-pays for medications under the hospice benefit should be no more than $5. It also can include aid and homemaker services, spiritual and grief counseling. But if a person is in a nursing home receiving hospice services, the services themselves are covered, but room and board would not be covered in a skilled facility. And then if someone is home receiving hospice services and the family is taking care of them, and let's say the family needs a break, the individual receiving hospice can go into a skilled facility for what we call respite care, and there's a 5% copay. Under original Medicare Part B, that's your medical insurance. That would cover doctor's visits, durable medical equipment, some drugs that are given in a doctor's office. And there is a premium for Part B that everyone pays. For most people this year, that premium was $148.50 per month. Experts were saying it would not increase more than $10 for next year. Well, that's not the case, as you can see. There was quite a hike in the Part B premium for next year. The new Part B premium next year will be $170.10 per month. There is also a yearly deductible, which increased from $203 this year to $233. Now, what that means is an individual in the beginning of the year has to pay, let's say you're going to the doctor, you're going to pay the first $233 of your expenses before Part B coverage will kick in. And then after that, you will have to pay 20% of the Medicare approved amount. Although for most preventive services, that 20% is waived. So if you're getting something like a mammogram or a colonoscopy, that 20% will be waived. In addition to these hikes, Part B is income adjusted. So if an individual is single and makes more than $88,000 a year, or married and makes more than $176,000 per couple, their Part B premium will be adjusted based on their income. So it will be higher than that $170.10. So that was not good news. Some individuals can delay enrollment into Part B. If you or your spouse have insurance under their current employer, and that insurance is primary to Medicare, and usually it is if there's more than 20 employees, you can delay enrollment into Part B. Because why would you want to pay for your Part B? Why would you pay your Part B premium when you already have medical insurance? To delay the Part B, you must inform the Social Security Administration. There is a form online with the Social Security Administration you can use, or you can call them. If you're employed and for some reason you become unemployed and you decide you want to keep your employer insurance through COBRA, you still have to enroll in Part B within 8 months. So what happens is COBRA can cover you for a full year for 12 months, but you don't want to wait 12 months to join Part B because you'll be penalized. You have to join within that 8-month period. If a person does not enroll in Part B when they are first eligible, there is a late enrollment penalty, which is 10% of the premium for each month you were eligible and did not enroll. And these penalties are for their lifetime penalties. So as you can see, there are some out-of-pocket costs associated with traditional Medicare. So to cover those costs, many people choose to purchase what's called a Medigap or a supplemental plan. Now in your packet, if you got it, you're going to see a chart that looks like this. It's got some yellow on it. And at the top, it says Medigap policies. There's 10 policies that people can choose from. There are monthly premiums for these policies, and the premium's going to be higher for the higher the coverage. However, there is a discontinuation currently of Plan C, the F high deductible, and F plan to any Medicare enrollee who enrolled in Medicare after 2020. For those of you who had one of these plans before that time, you are grandfathered in. Anyone who enrolled in Medicare before January 1st, 2020 can still purchase a Medigap, any of those Medigap plans. Be aware that these plans do not cover prescriptions, they do not cover long-term care, they do not include dental or vision care, but there are some guaranteed issuance rights. So a lot of people will ask, when's the best time to buy a Medigap plan? The best time to buy a Medigap plan is when you first enroll in Medicare, because in the first 6 months you enroll, these insurance companies that sell these plans cannot charge you more based on any pre-existing conditions you might have. They can't even ask you about your pre-existing conditions. However, if you wait to enroll after that time, they can ask you about pre-existing conditions and they can charge you more, or what's called underwriting. Also, in the first 12 months an individual is in Medicare, they can, let's say they decided to join a Medicare Advantage plan, they can drop the Medicare Advantage plan and get a supplemental plan. But again, the insurance companies who sell them can ask them about pre-existing conditions. So on this slide, this is a slide about Medicare savings programs, and these are programs to help individuals with lower incomes. And if you qualify for the QMB and you see the income and resource amounts here, your Part B premium and all deductibles and copays would be paid for. If an individual has slightly higher income and resources, there are 2 other programs that at least might get their Part B premium paid for. And at $170.10 a month, it's worth looking into if an individual has lower incomes. To enroll into these programs, one can contact the Department of Job and Family Services in their county, or you can call our Aging Resource Center, and they have applications and they can help you apply. So now we're going to move to prescription drug coverage under Medicare. These numbers are what we call the standard benefit in 2022. So what that means is a plan selling Part D has to have at least this coverage, can't have any less. The initial deductible cannot be higher than $480 next year. Again, that's up from this year. Some plans don't even have a deductible. Some plans have a lower deductible than $480, but no plan can have a deductible higher than $480 per year. The initial coverage limit for next year will be $4,430. What that means is once what you pay at the drugstore plus what the plan pays for your prescriptions hits that $4,430 mark, you would go into what we call the coverage gap. Used to be called the donut hole. It's really not a donut hole anymore because The Affordable Care Act made it so that now co-pays for prescriptions, once you hit the gap, can't be more than 25% of the cost of the medications. Then once your out-of-pocket costs reach $7,050, so this would be people who have very high medication expenses, catastrophic coverage kicks in. And at that point, an individual would only pay 5% of the total cost of the drugs, or $3.95 for generics and $9.85 for brand name drugs. With Part D, again, there are two choices. As I mentioned, most Medicare Advantage plans include drug coverage. So if you choose a Medicare Advantage plan with drug coverage, you've got your Part D. If you choose a Medicare Advantage plan that does not include drug coverage, and there are a few, you would have to select a separate, what we call standalone drug plan. Also, if you choose to get your coverage under traditional Medicare, even if you purchase a supplement, you would still need a standalone Part D plan unless you have creditable coverage through a retirement plan or through the VA. So some retirement plans, or if you're currently employed and you have creditable coverage with a current employer, you don't need Part D. So in your packet, you'll see a chart with a green heading at the top. And what this chart will tell you is all the standalone Part D plans in Ohio, because they're different for every state. And it'll show you what the monthly premiums are and if there is an annual drug deductible. And really, we only have I think 2 or 3 plans that do not have a drug deductible. Most of the plans do have that $480 deductible, as you'll note. We also show you the star ratings for the plans. And I want to mention you should never choose a plan with a star rating of less than 3.0. The other thing to remember about Part D is if, again, you do not enroll when you first become eligible, you will be penalized, and your penalty will be 1% of the average national premium for every month you were eligible and did not enroll. So if you are new to Medicare, or you're thinking about maybe dropping your drug coverage, it's not a good idea. You cannot enroll in prescription coverage in the middle of the year. So if you happen to get sick in the middle of the year or anytime during the year after open enrollment, you can't pick up a Part D. So I always tell people it's like car insurance and homeowners insurance. You don't want to wait till there's a catastrophe and then try and get coverage, because you won't be covered. So don't do the same with Part D. When considering how to select a Part D plan, it's very important to make sure that all your drugs are covered in the plan's formulary. You want to, of course, look at what the cost of your prescriptions will be. And the cost of prescriptions differs significantly between plans. So it's really important to look carefully at that. You also want to look at whether there are restrictions on the prescriptions you take. And those restrictions can include needing prior authorization, or quantity limits, or step therapy. And step therapy is when a plan requires you to use a cheaper drug before they'll approve a more expensive drug. Now, if a person has already tried other medications and they have not worked and they need a more expensive drug, your physician can do an appeal to the plan to help you get the drug you need. The other important consideration is their pharmacy network. Most pharmacies take all prescription drug plans, but you're going to get the cheapest price on your drugs if you go to what's called an in-network pharmacy. So you want to make sure that your pharmacy is in network with the prescription drug coverage that you choose. So how do you choose? Every year I say the same thing, and it's never going to change, folks. You have to do an analysis every single year. So you can do that yourself or have a family member help you by going to www.medicare.gov. That's the Medicare website. Or you can call Medicare or the Ohio Senior Health Insurance Information Program, and they have counselors that can do an analysis for you. What you will need is a list of your prescriptions, the dosages you take, how many times a day you take the prescription. So what happens is you insert all your prescriptions in the computer, and then the computer is going to spit back to you what your prescription costs are going to be, and it'll order them from the cheapest to the most expensive plan. And you can look at both Medicare Advantage and standalone drug coverage. I will tell you that my experience has been that coverage under Medicare Advantage generally is less expensive for some reason, but not always. So it's really, really important to look at this. And then you want to compare it to whatever coverage you have this year. For instance, I know an individual, I did this for a friend, and I looked at what coverage she has this year and what her prescription costs would be if she kept that plan. And then I compared it to two other plans that came up to be the most cost effective. And there was a difference of over $1,000 a year. So you really want to do this. Just as we saw with Medicare Parts B, there is also extra help for those individuals with lower incomes. The program is called either Extra Help or it's also known as the Low Income Subsidy. And here we have the numbers showing you the monthly income and resources, what the resource limits are for both single and married people. And this is actually the numbers you're looking at now would provide person with what we call partial subsidy, where they would get their prescription drug coverage with a zero premium under certain circumstances. But there is also a full coverage where a person can get a zero premium plan and only have to pay a very low copays for their prescriptions. For those individuals that would qualify for the low income subsidy, they'll get a zero premium in Ohio if they choose a plan with a monthly premium of less than $33.54 a month. If they choose prescription drug coverage with a plan that has a higher premium than $33.54 a month, they will pay the difference. Again, to apply for this program, you can call our Aging Resource Center, or you can go to the Social Security website, and there is an online application. So we talked about traditional Medicare, we talked about prescription drug coverage. Now we're going to talk a little bit about the Medicare Advantage plans. Again, to receive a Medicare Advantage plan, an individual has to have Part B. Most include drug coverage and a few do not. So in your packet, you got these colorful charts. And what we did was the last page of these charts has a lot of red on it. And those are the plans that don't include drug coverage. So we separated them out for you. So you can look at these charts and you can see the names of all the plans in the county where you live. Make sure you have the right chart for the right county. You can see their overall star ratings, and star ratings are important because they're quality. There's one indication of quality, and they can range anywhere from 1 to 5, 5 being the highest. We're very fortunate that we have many 5-star plans this year in all of our 4-county area. And you can actually join a 5-star plan at any time during the year. So I neglected to mention that. You can switch from one Medicare Advantage plan to a 5-star plan at any time. So we have several. We have shown you what the monthly premiums are. If there is a health plan deductible, that means a deductible for medical costs. We show you that under the premium. We will also show you if there's what the drug deductible is on each of these plans. Many have zero deductibles for prescriptions. Most of the plans don't charge more than $5 or $10 to see your primary care physician because they want you to get those preventive services. We will also note whether there's doctor choice. So if you look at the plan name, you'll see initials after each plan name. HMO stands for Health Maintenance Organization. With an HMO, you are required to use their providers. So their doctors, their hospital. You need to stay in network. With a PPO, that stands for Preferred Provider Organization. That is a larger network of providers. You are permitted to go out of network, but you might have to pay a little more. And then if it says HMO POS, that's a health maintenance organization with a point of service. And that's where your primary care physician can refer you out of network. And then the last column on that chart shows you the maximum out-of-pocket limits. And that's a very important number for people that have high medical expenses. So the higher your medical expenses are, the lower you want that out-of-pocket limit to be. And those out-of-pocket limits can range anywhere from about $3,400 to more than $10,000 per year. So pay attention to that. When COVID is over, so when the emergency is over, be aware that Medicare Advantage plans typically do not require a 3-day hospital stay before you go to a skilled facility for rehab. Traditional Medicare does, but these plans do not. But be aware of the provider limitations. So if you select a new Medicare Advantage plan, or even if you're returning to the same Medicare Advantage plan you had this year, you need to call your doctors and find out if they're still going to take the plan for 2022. They should tell you if they're not ahead of time, but many don't. And many providers actually change who they'll take and who they won't take from year to year. So make sure you check on that. Medicare Advantage plans also offer many additional benefits that you can't find under traditional Medicare. Most all of them now have some type of fitness benefit. Many are relying on telehealth. They also may have a benefit for over-the-counter prescriptions or other items you can buy at a pharmacy. Well, they'll give you a certain amount that you're allowed to spend, like every quarter or every month. And that's a good benefit to have. Many have dental, hearing, and vision benefits. Those can be limited, and you might have to use their providers. But some of those plans also have an extra package you can purchase where you would pay an extra premium for more comprehensive coverage. With these plans, we have 2 Medicare savings plans, and you'll find those on the last page because they do not include drugs. They are high deductible plans. So they only cover your medical costs once you meet the deductible. What they do is they deposit money into an account for you each year, and you can use that money to pay for your healthcare costs. But only services covered under Part A and B count towards the deductible, even though you can use it for other things. Like if you use it for glasses, that's not going to count. You can never be charged more than the Medicare approved amount. The plan covers all your costs then after you reach your deductible. But if you have money left in your account at the end of the year, it does roll over to the next year. There are also what we call special needs plans. These are not included in the chart. If anybody's interested in these, I'd be happy to talk to them more about these plans. These plans cover certain individuals. So there are special needs plans that cover only people who have chronic conditions like diabetes or heart disease. There are also special needs plans for people living in nursing homes and for people who have both Medicare and Medicaid. Some of these plans have premiums. Some do have both drug and medical deductibles, but the benefits vary significantly and they should be compared to other choices. If you are a person who has both Medicare and Medicaid, and you are on MyCare Ohio, if you are contacted by your plan to join their special needs plan, I want you to compare the benefits very, very carefully before you switch, especially when it comes to things like dental coverage, because I did have a client who needed a root canal. He was on a special needs plan. Under his Medicaid plan, that would have been fully covered. Under the special needs plan, it was not. So fortunately, that individual was permitted to change plans at the time. And so we had to switch him back to his MyCare Ohio plan so he could get his root canal. So you want to be careful. So what is MyCare Ohio? MyCare Ohio is a program for people who have both Medicare and Medicaid. These and do not have any third-party insurance. So these individuals have to either select CareSource or United Healthcare to cover their Medicaid, but they can also choose to have their Medicare coverage combined with the Medicaid. So it's all rolled into one. And this is called opting in. The benefit to opting in is that it includes extra benefits. So these individuals might get extra transportation trips per year to the doctor, and they may get some extra benefits for glasses or contacts. So again, these individuals can choose any type of Medicare coverage. They can choose to have their MyCare Ohio combined, or they can choose to be in traditional Medicare, or they can choose another Medicare Advantage plan. But again, I caution everyone to be careful and to please compare the benefits. Selection considerations for Medicare Advantage plans. You want to look at cost, and when you look at cost, you want to focus on the services that you know you use most. So if you know you're going into the hospital for a knee replacement, you want to look at what you're going to pay when you go into the hospital compared to what you would pay with the Medicare deductible. You also want to look at coverage. You want to make sure your prescriptions are fully covered under the plan's formulary. You want to make sure the doctors you want to go to and the hospitals are in the provider's network. And then you want to look at the extra services. You know, does it include dental, vision, and hearing? Most of them do. That coverage is often not comprehensive, but they may offer a more comprehensive package that you can purchase for an additional premium. For companies that have multiple plans like Anthem Senior Advantage or Humana, you'll see that there are multiple plans you can choose from. There are often many just subtle differences between the coverages. And if you use the Medicare website, you can actually search by company name so that you can look at, okay, I want to look at all the Aetna plans and see what the difference is, and you can compare them. Or I want to look at all the Anthem plans or all the Suma plans, whatever the case may be. You also, again, want to pay close attention to quality ratings. I don't recommend you choose a plan with a less than 3.0 overall quality rating. And you want to consider the plan's reputation. And I don't mean talking to your neighbor who says, I'm in XYZ plan and it's the best plan, that's what you should get to. That is not the way to choose a plan. Every person has individual needs, but what you can do is you can call your provider offices, your doctor's offices. When you ask them if they take a plan, you can ask them, how easy is that plan to work with? Because they're going to know how often a plan denies a service and how easy it is to get appeals through. So they may be able to give you some extra information about the plan. Again, you must conduct an analysis every year to look at the costs and coverage because these can change year to year. So you can go to the Medicare website, you can call OSHIP and talk to the counselors, or you can call Medicare and they can conduct an analysis for you and compare different types of coverage. So please remember to choose wisely. We do these seminars to remind you of what you need to consider. Now's the time when you can switch. You can, again, switch between Medicare Advantage plans, January through March, or you can switch from Medicare Advantage and go on traditional Medicare. What you cannot do is you cannot go from traditional Medicare to Medicare Advantage. If you have both Medicare and Medicaid, you're allowed to switch more often. So you can switch once per quarter. So for the first 3 quarters of the year. Okay, I'm going to talk a little bit about some new things going on in Medicare and some legislative things that have come up. This year we had something instituted called a 2-year senior savings model demonstration. And what this was that some Medicare Advantage plans and standalone Part D plans decided to offer predictable copays for insulin, not more than $35. And that will show up if you do an analysis. If you need insulin, that will show up and your costs will be lower. The reason for that was the cost of insulin was skyrocketing. So there was this demonstration going on. It will go on next year. Also new this year was that people with end-stage renal disease could enroll in Medicare Advantage plans, whereas before they could not. And if you also knew this year is if you have delayed your Part B because of current employment and coverage, creditable coverage, there is an online application to join Part B on the Social Security website, or you can always call them. Basically, when I looked at the difference between this year's plans and next year's plans, I mentioned we have several 5-star plans, which is a good thing. All the premiums and really number of plans remain fairly stable. I think we got an increase in the number of plans. There were some increases in out-of-pocket maximums for the Medicare Advantage plans, but not drastically. I saw continued low copays for primary care physicians. There is an addition of telehealth to most plans. So people can talk to a provider online. And then there was one new company, but only in Summit County, who entered our market, and that was Molina. Changes related to COVID-19. If you're tested for COVID, you will not have a copay and you will not have to meet the deductible. So tests are free. Medicare Advantage plans can choose to waive or reduce cost sharing for COVID treatments. That's going to be up to the plan. But Medicare Advantage plans have to cover an individual who's getting treatment for COVID if they were out of network and they can't charge them more. I did mention the 3-day prior hospital stay under traditional Medicare was waived, and vaccines and boosters are covered in full with no copay, no deductible. Medicare trustees do a report every year. So in this year's report, they said that they believe the Hospital Insurance Trust Fund, meaning Part A, would be solvent through 2026. This was improved 9 years due to changes instituted under the Affordable Care Act. And you have to remember that this particular part of Medicare is financed by employers and employee taxes. So since so many people were unemployed, there was some worry that it would have been affected by COVID, but they saw, at least so far, no effect from COVID. Parts B and D, those remain financed indefinitely because they get payments from the General Revenue Fund, which funds Part B and D at 75%, and then the monthly premium charges to beneficiaries at 25%. Legislation that's going on. Oh, go back to that slide, Lori. I want to talk about that increase in Part B. So we talked about how that increase on Part B was substantial this year. It is actually the largest increase in Part B that's ever happened. And the reason for this is interesting. I don't remember if I put a slide on this at all, but I'll talk about it now anyhow. There is a new drug for people with Alzheimer's called Adalimumab. And the cost of that drug is extremely expensive. Even though we don't even know if Part B is going to cover this drug, because the drug will be administered in a doctor's office subcutaneously, which means it's covered under Part B as in boy and not D. And if it is covered, they are saying that they increase that premium to cover the cost of that drug. Government also said they are seeing rising spending in medical costs due to COVID. So that was their reason for that huge increase. Okay, go ahead. Health and Human Services was asked by the government to do a report and talk about ways to reduce prescription drug costs in the United States under Medicare. They issued that report in September of this year. And what they did was they suggested a cap on prescription drug costs, and they suggested that this cap be legislated. We are not seeing that happen currently. House Resolution 3 was passed last year. It was introduced in the House. It was not passed in the Senate. It was reintroduced in the reconciliation budget bill. And what that said was that Medicare could negotiate prescription drug costs just like the VA administration does. That has been thrown out. So what we're waiting on now is the Build Back Better social spending bill. So recently, the one bill was passed, President's infrastructure bill. So the second bill is called the Build Back Better social spending. And initially that bill included adding dental and vision benefits to traditional Medicare. The hearing benefit it was dental, vision, and hearing. The hearing benefit does remain in the bill's current form. Dental and vision do not. And then we had the introduction of the Medicare for All Act this year, which is going nowhere. There was a proposed reduction supposed to happen to providers who take Medicare this year. And that luckily is not going to happen because the Medicare sequester relief bill was signed. And in that bill, they avoided that 2% across the board cuts to Medicare providers and their payments to them. The good news for those receiving Social Security benefits is that there will be a 5.9% raise this year. It's the highest raise we've seen since 1983. It amounts, for most people, the average increase will be about $92 a month. However, there'll be a reduction in that amount because of the increase in the Part B premium. They're just like the report on Medicare. There's also a yearly report from Social Security, and Social Security trustees reported this year that if there is no legislative action taken, there will be a shortfall in the Social Security Trust Fund by 2033. So keep an eye on what your legislators are doing or not doing. Now, they did increase the amount of the payroll tax. So this year, if somebody once somebody made $142,000, they didn't have to pay any more into Medicare. So next year, that's been increased to $147,000. And that's all I have for today, but I'm happy to take questions.
Okay, we did get a few questions. But before we get into those, I wanted to share our website real quickly and give people a chance to maybe gather some more questions as we're doing this. So we mentioned our website several times, and that is seen here, www.dhad.org. And when you first go there, this is what the page looks like. Again, I encourage you to click around and see what's there. As you go down here, we've got some COVID-19 information. As you go down, if you are looking for some help, you can click there and get information on our programs. If you are a family caregiver and maybe want information on those programs, that is there as well. And you can see some other things there too. But I also wanted to make sure folks knew where to get this information that Francine shared today. Once you are on this homepage, if you go over to this third blue block that says resources and education, once you put your cursor there, you'll see that drop down menu automatically populate. And if you go down to the fourth option, Medicare education, that's where everything that was shared here today and everything that you received in your packet is located online. So once you are there, you can scroll down this page. The first part just shares a little bit about what these Medicare seminars offer and include. And again, it talked about these being, again, this year on Zoom, information there. And then down below that is, again, where you will find all the materials that we share with you. This first thing here is the recorded seminar. And again, we did record this one because this is the first one we've done with those updated Plan A and B numbers. So give me till end of day to get this one up there. What is posted here today on our website is one that was recorded about a week ago. So it has great information, but it does not include those updated Plan A and B numbers. As you go down, we've consolidated some frequently asked questions. And then here, if you would like to review the slides that Francine shares as she's talking, that is all there as well. Again, scrolling down, you've got all the Advantage Plan comparison charts for our 4-county service area, those extra help plans that was discussed, and then other preventative services and resources are available down below. All you have to do is click on those links and it will bring up those documents for you. So I just wanted to make sure people were aware where to find that. And now we can go into our questions that have been collected. I'll start with the first one. Francine, when you were talking about traditional Medicare, it says the full coverage days are days 1 through 20. And the question is that per episode, meaning it can happen multiple times over the course of a year, or is it 20 days total for the entire year?
It can happen multiple times if it's for a different episode, not the same episode. So it's for a different condition.
Okay. So the next question is under the QMB, they wanted to make sure it looked like the rates for married couples might have been a typo. It said the married income lower than $14,572 a month with resources lower than $11,960.
Was it the resources or income? I'm sorry. Say that again.
Looks like the married income was typed at $14,572.
That's probably a typo. It's probably 1472.
And then next question. if a person reaches the age of 65 and is still working, are they required to apply for Medicare Part A?
No. You're not required to apply for Medicare Part A. However, if you have insurance through your employer and it's a high deductible plan, so let's say you have to pay the first $4,000 or $6,000 of your medical costs, you might want to enroll in Part A in case you end up going to the hospital.
Okay, and the last question that we've gotten, I spoke with a broker yesterday, and there were some people answering this question as well. So I wanted to make sure we touched on this one. I spoke with a broker yesterday regarding Medicare supplement plans. I was told that all of these plans offer the same amount of coverage as it is all standardized. The only difference would be in the premium you pay. You mentioned different amounts of coverage with these plans. Was I given incorrect information from this broker? And this doesn't include any dental, vision, or prescription.
You were not given incorrect information. So Plan A, Plan B, Plan C, whatever the plan is, they're standardized throughout the United States. So they're the same. Typically, there are some state differences, but typically those plans are going to be the same in Ohio as they are in California. The coverage will remain the same because they go with traditional Medicare. So you can go to any Medicare provider across the United States.
That is the last question that I have seen come in the chat window. Again, folks, if you come up with a question, as you're taking this information and reviewing it on your own and something comes into your head, please do let us know. I put both Francine and my contact information in the chat window, and I'll do that again. So again, if you come up with something after, go ahead and contact us either by email or give us a call, and we are more than happy to help. Otherwise, thank you for joining us here today. We appreciate your time and attention.
Yes, thank you so much. And we hope to see you in person next year. Fingers crossed.
I'll hang on here for a few minutes if there's any questions or anything.
Me too.
Yeah.
Happy holidays.
Yeah. Otherwise, have a great day. Enjoy.